People in our communities who are in crisis deserve compassion, understanding and support, not force and restraint. Manal and his peers, I think, can be justifiably proud of everything that promise stands for, what it seeks to achieve, and what we'll all learn and take away from today's event. Now, here in Cambridge, I've got some very fond memories. I joined the constabulary here. This is my first posting back in 1986, and I started walking the beat here in Cambridge. Now, many years later, with a career spanning crime investigation, operational policing, I'm now the force lead for mental health and have responsibility for how officers and staff in the constabulary are trained, developed, equipped, and how we deploy our officers to best respond to those in mental health crisis. And it takes me back to some of my early experiences over my years of policing and mental health. Many of the good, however, some sadly ended in tragic circumstances. Here in a house not far from here, as a young PC and the van driver, I was called to an incident where a doctor had sectioned a young man who was a student here at one of the colleges studying medicine. The doctor wanted to get him to Fulbourn, needed our help. He was uncooperative, he was violent, and a colleague who had attended earlier called for urgent assistance. So many of us responded as could be expected. The young man was forcibly restrained and transported to Fulbourn in the van. We all left, thought nothing more of it, got on with the day job. Yet within hours, that man had walked out of Fulbourn onto the railway line and killed himself. Now, for many years, I never really thought much more about that. It's just one of those things, it's part of the job. Fast forward a little bit further forward. A second young man, again a student here, is arrested by a colleague of mine for drink driving. He was distressed, he resisted arrest and had to be physically restrained. He did calm down and we put him into the back of the van that I was driving. However, as I drove off, he jumped out of the back of the van as it was still moving. In those days, we didn't have cages, there was no security to stop anybody from getting out the back of the van. You could literally just pull the handle and out you'd go. He died a few days later from the head injuries he suffered. It transpired he had an extensive history of depression and mental ill health. All things we had no way of knowing about or ascertaining when we first came across him. More recently, 2013, a young man with a long history of mental health problems died in custody, in police custody in Luton. He'd been found in a distressed state in the street and was detained under Section 136 of the Mental Health Act. The officers, again, were unable to ascertain any information about the young man when they first encountered him on the street, information that may have helped understand how best to deal with him at that time. Now, would this have made a difference? Only time will tell. The Independent Police Complaints Commission are still investigating that case 2 years later on. Those officers, 6 officers and staff, remain suspended and under investigation. Now, this young man had been detained under 136 of the Mental Health Act, taken directly to the police cells, not to a health-based place of safety, which is, by all accounts, the standard practice. Now, these are 3 very, very different scenarios, but it all has a common thread, and the common thread is that interaction of police with those in crisis and the use of restraint. And it was the Luton incident that made me stop and think, you know what, we've got to try and do something different. How many times does it take to have people die in police custody or as an indirect result of our interaction with them before we do something different? Now, over the years, we've seen Lord Bradley's report on mental health in the criminal justice system. We've implemented a range of changes and training and protocols. Lord Adebowale's report following the death of a young man in custody in London. And we've put in place comprehensive plans to address the recommendations here in Cambridgeshire, but I didn't think it went far enough. At the time, over 60% of everybody who we detained under Section 136 came straight into our police cells, not a health-based setting. We are exercising that power more and more and more over the years than we'd seen in the past, with a massive increase in mental health-related incidents and demand. Now, the data is not completely accurate, but certainly in 2013-14, we know at least 280 people were detained under the 136 Act. In the first 6 months of the following year, that number has increased to 160, so already sort of topping the 300 plus mark. Now, I'm confident that the Bradley and Adebowale reports had an impact on officers. They're more aware, better trained to spot the signs, but despite this increased knowledge, this wasn't matched in terms of their ability to make the best choices. We had no access to information that could help frontline officers make better choices. And I didn't want my officers to be continually exposed to the risk of litigation or misconduct simply because they didn't have a choice as to what the right thing to do was or where to go. Equally, and more importantly, I didn't want the individual in crisis to face the indignity and risk of harm by having to be forcibly restrained and taken into a police cell. It was not and never will be the right thing to do. They need professional medical support, and a police cell is not the place for that. Now, we're engaged as partners, working to try and come up with some solutions, but at a very operational level. We had a protocol. Unfortunately, it favoured police cells over the 136 suite. We had an inconsistent response from other colleagues, social workers, doctors, and so the person was in a cell, so therefore safe. And as a result, on countless occasions, we saw people sitting in police cells for up to 24 hours or more awaiting a further assessment. And what was particularly stark was, despite being detained and then assessed, over 75% of people were actually never admitted into Fulbourn at all. They were released and let to go on their way. So back in 2013, we had no governance, no county-wide governance or ownership of crisis care for individuals from across the different organisations who had a role to play in mental health. There was no single group or partnership board that I could go to address the fundamental question: how can we work together to make sure that individuals in crisis get the right support at the right time from the right organisation? 2014, the Mental Health Crisis Care Concordat landed here in Cambridgeshire, and for me this represented the opportunity to address the core question. The Concordat set out very clearly an expectation from government on a wide range of agencies to work together to improve outcomes for people experiencing mental health. Over 22 national departments and bodies are signatories, and it is absolutely plain to me that here in Cambridgeshire we had to follow suit. August 2014, the Police and Crime Commissioner, Sir Graham Bright, hosted the first Concordat Roundtable, bringing together 21 different agencies from across the spectrum: health, local authorities, commissioners, emergency services, the trust, as well as service users in the third sector. It was a first here in Cambridgeshire for us, and in many respects an opportunity to make that difference. We're one of the first areas in the country to sign a Concordat declaration committing as partners and making a long and strong lasting commitment. A commitment where we will work together to implement the principles of the Concordat, improve the system and care and support so people in crisis are kept safe and help to find the support they need, whatever the circumstances they first need help. We're committed to work together to prevent crisis happening wherever possible through prevention and early intervention. We'll make sure we meet the needs of vulnerable people in crisis, providing them with the right care at the right time and from the right service. And we'll also strive to ensure that all relevant public services, voluntary and private sector partners, support people with a mental health problem towards recovery. And most importantly, we will develop ways of sharing information where appropriate to enable frontline staff to provide a coordinated support to people in crisis. And finally, we placed a burden of accountability on each and every one of us, ensuring we are responsible for delivering this commitment to the people of Cambridgeshire and Peterborough by putting in place, reviewing and regularly updating our action plan. Now, as many of you know, working as partners isn't easy. It requires shared understanding, shared vision, a shared commitment. Sometimes it means one has to give a little, relinquish what some may view a little bit of their own sovereignty over their own organisation. But it does need us to be innovative, think and work differently, recognise organisational cultures are very, very different. It requires we all work tirelessly to make things work, even when it means it might have a negative impact on your organisation. We can't afford to be parochial, because at the end of the day, it's the overall benefit that we must remain focused on, the benefit to the individual who needs our help. It doesn't matter who they turn to or when, they should be entitled to support which is accessible, compassionate, and designed to help them. In Cambridgeshire, we've embraced the Concordat. We're working as partners, and we are striving to make that difference. Just this week, we've between us agreed to jointly fund an exciting and innovative model of street triage, embedding mental health professionals into the police control room so that officers and staff on the front line can be provided with the right information and immediate advice and guidance. We will keep people safe from harm by sharing information, because the information we share will enable our staff and colleagues to make the better decisions we need them to make, decisions that are in the interest of the individual who needs our help. That support and guidance can also extend across to local authority colleagues and other emergency services. I foresee the triage model being at the heart of a 24/7 crisis response capability that extends across a range of partners in the third sector. We've committed funding for an implementation manager, a post hosted by colleagues in Mind, which has made a huge difference. Many of you would have met Lynn Mars, and she's worked tirelessly shuttling between partners, but acting on all of our behalf with a single purpose. Many other agencies around the country, they've looked at us here in Cambridge and looked at that approach, and they've really looked with envy as to how we've done that. We also have Mind as a co-chair on the Concordat board. Again, an innovative approach that embraces the value, objectivity and diversity of thought that we need as a partnership. Sarah, as chief exec, she keeps us grounded. We cannot try and sort of act as public sector professionals who think we know best. And she brings a valuable service user-centric focus, which keeps us on track. Dr. Emma Tiffin is the third co-chair, who represents the CCG. Overall, we've got a solid foundation and the right building blocks in place to make a real difference. It's the Concordat which has helped enable that. It's created the environment where we can work as partners, share problems, share the design of the solution. And from the constabulary perspective, I absolutely know it is actually working. We now see fewer than 1 in 10 136 detainees coming into police cells, despite an increasing number of detentions over time. Street triage, I'm sure, will help reduce that demand and do so significantly. And we will continue to implement plans to improve services across the partnership. I personally have seen too many people die in tragic circumstances as a result of the combination of mental health, restraint, and policing. I've seen colleagues caught up in this as a consequence of being unable to make a better decision at that time. I don't want to see that again, and I'm convinced that I don't need to as a result of the Concordat. And the commitment from many colleagues, many of you here in this room, to make this a reality. Thank you.